Understanding the concepts of conditional dependence between two diagnostic tests. In clinical practice, patients often receive multiple diagnostic tests for a medical condition. The test results may not be independent. For example, if a patient has a positive or negative test result in one test, the likelihood of having the same test result in another test may be increased. The conditional dependence between tests can be modeled by the unmeasured or unobserved covariances, conditional on disease status. The expressions for joint probabilities of two correlated diagnostic test results are given in this table. COV-S denotes covariance between sensitivities, and COV-C denotes covariance between specificities. Ignoring conditional dependence between tests would exaggerate the incremental value of the new test, and accounting for it can potentially lead to different cost-effectiveness results. An example of modeling the conditional dependence between diagnostic tests can be found in an article titled Developing Economic Models for Assessing the Cost-Effectiveness of Multiple Diagnostic Tests, Methods and Applications. Next, we will discuss the magnitude of COV-S and COV-C. Let 0 be the minimal value for COV-S and COV-C, which indicates that two tests are conditionally independent. For the disease-positive group, the probability of having positive results in both tests cannot be greater than the probability of having a positive result in either test. Then, we can derive the upper bound between the sensitivities. The same applies to the disease-negative group, where the upper bound between the specificities. Theoretically, the lower bounds of COV-S and COV-C are negative values. A negative value of covariance S means that a person with a positive test 1 result has a decreased likelihood of a positive test 2 result, compared with the independence case. However, a negative COV-S and COV-C do not often occur in clinical practice, and we can assume the lower bounds of COV-S and COV-C are 0. When the sensitivities and specificities are high in both tests, close to 1, conditional dependence would be negligible. For two tests, it is possible that only sensitivity or specificity is correlated.